What I've experienced in the past 2 weeks is abuse.
1 in 7 people in the UK population is on the NHS hospital waiting list.
So, what is the point in having a health service if it doesn't work?
For the first time ever, there are over 7.5 million people on the list, waiting for routine checkups including hip and knee operations.
In the United Kingdom, there is only one consultant neurologist per 91,000 people.
After 35 years of working in the NHS, nothing prepared me for the shock I felt when I was told I had a year to wait to see a consultant.
Guys, the UK health system is so far behind compared to other countries, and let me tell you why.
People say the NHS is great and doctor surgeries are good. They're not. They're really not.
With 300 to 500 people dying every week in the UK because of delays to emergency care.
The NHS waiting lists have got to be a joke, right? Right?
The NHS is hanging by a thread and patients are paying the price, sometimes with their lives. Waiting times are a joke. Doctors are overworked and leaving. People are stuck in endless queues. Ambulances are taking hours and hospitals bursting at the seams. At this point, healthcare isn't about getting help. It's about hoping you don't need it.
So, I had to call the doctors this morning and I feel like this is just a joke, but it's not. This is just reality in the UK. I was 29th in the queue at 8 a.m. They open at 8 a.m. and I called at 8 a.m. Bang on. Literally, the time went down and I called. So, God knows how I was 29th in the queue. Anyway, it was ridiculous. 8 a.m. I'm feeding the kids. I'm getting them dressed. I'm like dealing with multiple arguments. I've not got time to be waiting around 40 minutes for you to answer the phone to then tell me that you've got no appointments left. And I've got to call again tomorrow. Like, is this just the way things are now? Because, like, I don't have the money for private healthcare. I haven't got that.
1 in 7 people in the UK population is on the NHS hospital waiting list. For the first time ever, there are over 7.5 million people on the list, waiting for routine checkups including hip and knee operations. And over 383,000 people have been waiting on the list for over a year. And obviously a lot of this is down to the impact that the NHS strikes have had. I think a common mistake when discussing the strikes is the idea that the government genuinely cares about the NHS, but behind the scenes there is a lot of indication that they have been trying to privatise the NHS for many years. Labour's health spokesperson Wes Streeting has said that private firms would be used to reduce the waiting lists. The government is deliberately expanding the role of the private sector market by forcing the NHS to rely on it, while refusing to commit to long-term workforce planning. New strike dates have been announced for the 24th and 25th of August, in response to a 6% pay rise for NHS medics. The British Medical Association has described the below-inflation pay rise as insulting. The tax on NHS workers' pay will drive them away, which will have devastating effects on our health service. And we can see this in the healthcare inequality in countries like the US. Ministers continue to publicly claim their support for the NHS, all the while they are investing in private providers, and refusing to take any important action to help secure the future of the NHS.
If I invite 10 people to my Christmas lunch and I spend £100 on it, and the following year I invite 20 people to Christmas lunch and I spend £150 on it, I can say I've spent the most ever on Christmas lunch. Doesn't mean they're getting a better lunch. And that's a bit like this when you try and use statistics like this. It doesn't really matter. We're faced with a problem just now, which is NHS workers are leaving in their droves. Those who are there are stressed out because of the job they do. People, if you walk into a call centre, the stress and tension is palpable, and these are people who are earning under £11 an hour.
I just paid £400 for an MRI. Yes, you heard me, £400 for an MRI scan. Like, we know the NHS is getting bad, but guys, the NHS is really getting bad. Side note, if you're the loonies from the other videos that think that anyone can put on a wig and a dress and think that they're a woman and try to say biology doesn't exist and think that anyone should have access to changing rooms where women are and where young kids are, scroll off this video. You don't possess the intellect to understand what I'm gonna say. So guys, I needed a scan. And I thought, got a doctor's appointment finally. Yeah, we all know waiting times are bad. Imagine they gave me an appointment for December 2025, not for the scan, just to see a consultant. That's right, that's more than 9 months waiting just to see the consultant. Mate, we need to do something about this NHS. I heard Starmer's getting involved with NHS more. We need to really realise what's going on here, and also we need to save money if you can. A little £5 here, a little £10 there, a little £15 if you can, and put it towards a health box, like a health pot. If you have Monzo styling, you know, the digital banks, put a health pot, start putting money back, because it's only by the grace of God I could afford to pay for that £400 MRI. If I didn't, I would have to be waiting until December just to see a consultant, and who knows what could be going on with my health. Health is wealth, as you know. Mwah, have a good week.
After 30 hours in A&E, I finally got a bed. In the corridor.
Guys, the UK health system is so far behind compared to other countries, and let me tell you why. So over the last few months, I've had some problems with my skin. I've recently moved to Thailand as of maybe 2 weeks ago now, and I'm still getting the same problems, and I've been suffering with it, I'll be honest. So I thought, you know what, let me just go to a walk-in doctor's in Thailand, let me see what it's like. It's probably going to cost me a bomb, but let me just go, because I need to get it sorted, you know what I mean? And bearing in mind, in the UK, I've seen over 5 GPs, and none of them had a clue what it was, and what they did diagnose me with, was not even the right thing. So tell me why I've walked in the doctor's and I'm seen within 5 minutes. I just had to sign a form. I'm sitting down in the doctor within 5 minutes and he tells me exactly what's wrong with me. Literally straight to the point. None of this and ahhing, none of this, oh, I don't know, it could be this, it could be that. Let me try you on this, let me try you on that. He literally just said, look, it's this and this is the medication I'm going to give you for this. And literally 15 minutes later, I've walked out, I've got my medication, I'm going back in 4 days. And the next thing you're probably going to say is, Cam, while the NHS is free in the UK, it's free, you've probably paid loads. This cost me less than £15. And that's including to see a doctor and to also get my medication. Am I missing the point here, or is the UK just so far behind? Let me know in the comments, man, because this is bad.
Right, okay, you lost your leg and you're bleeding. Fair. 1 sec. Hold on. Right, okay, can I just confirm your name, please? I know you lost your leg, but I need your name, alright? Jessica. How'd you spell that? Are you conscious and breathing? What's your postcode, please? No, you lost your leg, alright? But I need your details, okay? Yeah. Listen, love, do you have any paracetamol or ibuprofen that you can take right now so we can carry on the fun conversation and I can book you for an appointment? You don't. Can you pop into Lidl or Sainsbury's if you have money and get yourself an ibuprofen or paracetamol, then call me again? And remember, excuse me, remember we close at 4. Alright, thank you, bye.
Quickly talk about the GP system in this UK. Yeah. So, I have to call at 8 o'clock in the morning. I'm behind 500,000 people. I finally get to the front. The woman says to me on the phone, oh, we need to book you for a telephone appointment. Babe, I need my blood test done. What are you talking about? What do you mean I need Anyways, get a telephone call. You're going to be called between 8 a.m. and 12 p.m. at night. Okay, fine, whatever. Get a call. Oh, you need to come down. Cool. You go down there. Very rude little lady at the desk. No morning, no hello, no nothing. What time's your appointment? Look at me as if I'm boo-boo the foot. Who are you talking to? And who are you looking at like that? Very rude. I'm very polite and respectful. I expect the same. It's a normal... Anyways, then sitting down in the waiting area. Bro, why am I waiting 20, 30 minutes with no apology? No nothing. And the thing is, it might not be your fault. But you could just say sorry. Sorry for the delay. Because that's what Anyways. But if I'm late, if I cancel, party's done, don't ever come here again. You're now off the booking system, don't ever come here again. And it's the same thing for these beauty therapists. Why is it you got to put down a deposit, but if I'm late or if I cancel, deposit done, don't ever come here again. Blocked on social... But if you're late or you cancel, then it is what it is. No, bro, no. I'm going to start charging it to the game. I'm putting it back on people from now on. You are taking 20% off of my... Yo, we got to start charging it to the game.
NHS waiting times are an absolute joke. So I've been on the waiting list with the NHS for something for about 8 months now. And it's gotten to the point where they are basically even telling me that NHS is a joke. These are actual NHS employees telling me that the NHS is overwhelmed and it's just not what it used to be. And I think it's great that we have the NHS. I think it's great, we pay for it, but I do think it's great. It's better than countries like America where if you don't have private healthcare, you're screwed. But I think there comes a time where you've got to look at the marginal benefit that you're getting. So I eventually got fed up with the NHS and I've decided to go down the private route. So I went to a private doctor and I explained what I'm going through. The initial consultation was £300, and that was just to be seen. Anyway, after going through the consultation, that doctor mentioned that there was a slot that I could be seen that very day, like the same day. And it just made me think how many issues and problems that people have in life that can just be solved by just having money. Like, I'm not a huge fan of having money to be flashy and show off on other people. But I think if you can amass some money and use it for good, like when you have health issues, you can get them sorted out quickly, you can help your family members, is such a flex.
After 35 years of working in the NHS, nothing prepared me for the shock I felt when I was told I had a year to wait to see a consultant cardiologist. I had the start of a dissecting aneurysm, so it was a bleed from the main artery from the heart. I would have died certainly if it had ruptured straight away. And I was told it was a 12-month wait to see a cardiologist urgently on the NHS. I think it was just sort of, God, a year, bloody hell. When I was in general practice, it would have been an urgent referral. You know, they'd have been seen within 2 or 3 weeks. So I thought, well, I'll try and lose weight and I'll keep taking the tablets and I'll try and improve my exercise tolerance. But it just wasn't working. I was feeling exhausted. I was used to being active. I was used to cycling and walking. And suddenly I was having to be looked after myself. No, it was very demoralising. It was very upsetting. And then just feeling after 5 months, I just couldn't go on. I did have to wrestle with my conscience about whether I should see somebody privately. I had worked for the NHS for, 35 years, always believed in it, always felt that it was the right thing, that it should be available to all, free at point of delivery. It really hurt me. It was a very difficult decision to make. Once I'd made the decision to see somebody privately, I was seen, I think, the next week. 10 days later. And I'm now on treatment that definitely has helped. I don't feel I'm inhibited anymore. Thank God I did have money to do that. There must be tens of thousands of people in a similar situation to me, waiting and feeling in the end that they have to, if they can, scrape up the money to see somebody privately to get that care that they need. And they shouldn't have to. Everyone who works in the health service wants to do a good job. There's more and more demand and there are more people on each list. They can't provide the service they want, and it's demoralising and ineffective and actually scarily, not safe. I think the NHS is in a state of collapse. It is critical that the incoming government puts the resources in to support it, to revive it, to give it life-saving treatment, because it needs it. We all need it. We all depend on the NHS. It's the most precious thing. Our health is the most precious thing.
This isn't a rant, but it's really serious. And it's not personal. But we need to talk about the neurology crisis that exists in the UK. In the United Kingdom, there is only one consultant neurologist per 91,000 people. That's 1.1 per 100,000. In France and Germany, by comparison, there is one per 25,000 people. There is only 1,638 people in the neurology workforce in the United Kingdom. What this translates to in the reality is that there are 174,000 people in the UK waiting more than 12 months to see a consultant neurologist. And there are 51,000 people waiting more than 12 months for neurological surgery. What this means on the ground is that people like you and people like me are told when there's a clear neurological problem that you are going to have to wait for 9 months, even for an urgent referral. And in my case, my GP said, you need to go private. But all well and good, but what if you can't afford to go private? What happens then? This is a really serious crisis that we've got to get to grips with, because that means that people are waiting for, getting benefits and getting help or getting signed off work and getting the assistance they need. It means that people are dying when they might not necessarily die. There is a clear problem here. And I know that there is no quick fix, but man, do we need to work on fixing it and raise awareness around this, because frankly, this is completely unacceptable. And having been on the receiving end of this crisis, I will tell you that people in the NHS are beautiful, like amazing, sacrificial, working in some harsh conditions. And it needs better support from government.
Hi, thought I'd just pop on. So I was walking through town today, I had both the kids with me and I seen this woman fall over. Now it's been raining, it's windy, it's just overall not nice weather out there. Why I decided to go to town today is beyond me. Anyway, I go over to her, she's fallen over and she's hurt her shoulder. Now, she was instantly saying that she felt sick, so I thought, yeah, something's obviously not right. And by the looks of things, she had dislocated her shoulder. Now, we'd phoned for an ambulance. The ambulance said not to move her. Keep her on the floor in the rain and the wind. Keep her on the floor, keep her warm and dry. And then they will send somebody out. However, the wait time was going to be 4 to 6 hours. Now, I don't know about you, but 4 to 6 hours on the ground, in the rain, in the wind, just seems mind-boggling. How can they leave this woman down there? She was 73 years old. She was clearly in pain and they wanted to leave her for 4 to 6 hours. I'm just lost for words. Is this the same where you guys are? Like where you live? Do you have to wait 4 to 6 hours for an ambulance? I appreciate the NHS. Obviously, of course, everybody does. They do so much. Healthcare's so expensive. But 4 to 6 hours. Is it the case that we have a recruitment problem going on in the UK? Do we need to be recruiting more ambulance drivers, nurses, doctors? Is it that we're not paying them enough? Is it right that, they're going on strike and that we should be, looking at their wages? Let me know what you guys think, because I just think that 4 to 6 hours in the rain, in the wind, at 73 years old is disgusting. Imagine if that was your grandparent. Like, I think I would be shocked to find out that my grandmother had fallen over and was on the floor for that long. It was absolutely disgusting that they were going to leave her there that long. Luckily, one of the other guys that was there phoned them up and explained the situation again to somebody else who seemed a little bit more forthcoming and wanted to actually help. Luckily, they did manage to send somebody out, but it still took up to an hour after she'd fallen for the ambulance to even agree to come out to the scene. It was just absolutely crazy. I cannot believe what I witnessed. Let me know what you think in the comments.
The NHS waiting lists have got to be a joke, right? Right? I've had this undiagnosed stomach issue for more than 3 months now, and it took an entire month for my doctor to actually give up on trying to figure out what it was and put in an actual referral. I got a letter shortly after that said, if you haven't heard anything back from this referral by the end of July, give us a call. July came and went. I gave them a call and, well, this is how it went. Hi, I'm chasing a referral that was made through your surgery. These are my details. Hello, yes, we can see that your referral was made on the 31st of May. Yes, that sounds about right. It was probably about that long ago. Okay, we're currently working through referrals that were made to us in December 23. Okay. So you should hear something back from us early next year. Right. Okay, that's... okay. Is there anything that can be done in the meantime? Yes, of course. If your symptoms get any worse, just go back to your GP and they'll be able to help you. Right, great. Thanks. I don't know what to do. I'm panicking. Because my job have been insanely supportive and patient with me. But this is too much. I did phone my doctor because my symptoms did get worse after the MRI, and she just repeated the same old, well, we just got to wait, you're not in hospital at the moment, it's not that bad, so we're just going to have to wait until you can see that specialist. I am probably just going to have to go down to the Citizens Advice Bureau and see what they say, because I'm genuinely scared right now.
Rishi Sunak has refused to say the health service is in crisis and says he is confident the NHS has sufficient funding. The latest figures from the Emergency Medical Journal tell a different story, with 300 to 500 people dying every week in the UK because of delays to emergency care. 1 in 3 patients seen by ambulance are waiting over half an hour to be handed over to A&E, sometimes critically unwell patients. Some of those waits have extended to hours. Picture isn't much better once you get into hospital, with 40% of people that need a hospital bed having to wait longer than 4 hours for one, sometimes up to 2 days. This is how a junior doctor described it. The system is completely overwhelmed, there's no quick fix, it needs a significant amount of funding, but it's also about restoring the goodwill of staff who have given so much that they don't have any left. So with nurses across the country staging strikes, junior doctors voting to strike, paramedics going on strike, people waiting over 4 hours just to be seen, let alone get a bed when they need one, Rishi Sunak's response was to say the NHS is not in crisis and it has enough money.
This is more than just poor hospital care. God help me. What I've experienced in the past 2 weeks under Bart's Health NHS Trust is abuse, neglect and cover-ups. And I've been speaking out. I'm speaking out now, not just for myself, but for the vulnerable patients who can't. I've been recovering from spinal surgery, completely dependent on nurses. And instead of care, I have faced neglect, isolation, and outright cruelty. I have complained repeatedly to the nurses in charge, to the ward manager, to the site manager, and even the doctors. And every time my concerns were ignored, dismissed, or covered up. And I have watched dementia patients being abused, mocked, mistreated and neglected because they can't even remember long enough to complain. And when I raised these concerns, I was met with excuses and lies. When I directly accused staff of mistreating me, I was met with more lies, gaslighting, and then just silence. The neglect I faced has included nurses moving my call bell out of reach, so so I couldn't ask for help, deliberately delaying my medication, liquid morphine, which is supposed to be for my pain relief, refusing to help me to the toilet while I was immobile after surgery, forcing me to use a Zimmer frame before I had even learned how to stand again, leading to a fall where I was left on my back. I fell on my back and I was crying for hours in pain. Lying to cover for each other, when confronted with the ward manager, defending their actions instead of holding them accountable. The nurse in charge had the audacity to say to me that they barely get complaints. And I told her that's because most of your patients have dementia. They can't remember long enough to even report you. It took me screaming my complaints out loud to the ward, to even be acknowledged, because talking privately to the managers, to the nurses, and, they did nothing. They promised investigations, they promised follow-ups, they promised calls and emails. None of it has happened, none of it. I was ignored because this hospital operates on a culture of silence, of protection, not patient care. And I don't know if I need to sue or expose them fully yet, but I know this. I will not be silent. I have recorded proof where I can. I have documented everything. And when I'm finally out of this hospital, I will tell my story step by step. I will fight for myself and I will fight for the patients who can't. Because if this is happening to me, if this is happening to even dementia patients, how many others have suffered in silence? How many others have been ignored? It has to stop.
Hello and welcome. I'm John. This is Backseat Talks on Amelia the Bus. And today we've got some shocking figures regarding the NHS and how bad it's got since 2013. The figures I got sent yesterday blew my mind. I couldn't actually believe it. So what is the point in having a health service if it doesn't work? And I think that might be deliberate. Now, the figures are, since 2013, we have had a 1,000% increase in waiting times, 10 times longer to wait at A&E than you did in 2013. Cancer treatments, 14 times longer. That's 1,400% worse 10 years later. And anyone who gets admitted on a trolley to get it into the ward and get a bed, 1,600% worse. 16 times longer since 2013. So with all this record money going into the service, what on earth is this result? If anyone did this in a normal job with that level of incompetence, they would be sacked and probably disciplined severely. They would be taken to right because they have messed up and caused so much damage and pain to people's lives, because the NHS isn't just a normal business. It deals with people, it deals with health, and not to actually be sustainable, as in it's not sustainable when you're throwing apparently bucket loads of money at it, record numbers, and the results are thousands of % worse than it was 10 years ago. So my question is this: with the bus, we do sustainability. So there's no point in insulating all of it and then just leaving 2 windows open and maybe the door and complaining that the energy we're throwing into it doesn't seem to be working. No, because there's a big hole. So my question here is, what is the big hole in the NHS? Where is all this money going? It's obviously not going into the actual services. And, you know, we had Nightingale hospitals and everything during COVID. What happened to all of them and all of that money? So these are the questions we have to ask and get these incompetent idiots out of government, and they must face penalties for what they've done. But I'd love to know your thoughts, because how can we have a good health service when there's not prevention but it's always cure? Is that by accident or is it by design? Because it's beginning to look like it's by design, because the companies that supply the products for the cure benefit from it. I don't want to think that badly, but it's beginning to look like that's exactly what's going on. If anyone works there and would like to get in touch anonymously, the details will be kept safe, but I'd also love to hear in the comments openly your thoughts, your experiences, and where you think this money is going. I've got a feeling it's going to these private companies and to way too many managers, but would love to hear more, because it's with the knowledge that we can actually take action to fix it. Thanks for watching.
Okay, so it's a new year, and the Labour government, who have been in power for about 6 months now, have just announced a bunch of new NHS and health policy announcements, which unfortunately looks set to further entrench privatisation of our health service and actually fail to address the real challenges that the NHS is facing. So here's everything that you need to know. So first up, the Health Secretary Wes Streeting announced that the government is launching an independent commission to reform social care and create a national care service. Now, it's true that fixing social care is an essential part of tackling the crisis facing our NHS. But here's the catch. At the same time as announcing this commission, the government also admitted that any reforms would not come into practice until at least 2028. So as reported, this huge delay is going to cost lives. What patients in the NHS actually need is a plan funded by progressive taxation that can be implemented within 18 months. Then a few days later, Keir Starmer announced a new plan to reduce NHS waiting lists and tackle hospital backlogs. These plans include expanding the network of community diagnostic centres and surgical hubs, upgrading the NHS app to improve patient choice, and also increasing direct referrals for tests and scans. Now, some of these reforms are welcome and could make a difference to patients, but they will ultimately mean nothing if they're not accompanied by significant uplifts in the NHS budget after years and years of cuts and underfunding. The modest increase that the government announced in their autumn budget is at best around a quarter of the additional resources that our NHS actually needs. And alongside urgent investment in repairing and increasing hospital capacity, the single most important thing that this government could and should be doing is investing to tackle the NHS staffing crisis. Yet none of their new policies are aimed at improving paying conditions so that the NHS can actually retain the people it needs to deliver care. But perhaps most worryingly, Starmer also revealed a new deal with the independent sector, which will see more NHS patients being treated in profit-making clinics. This will increase the private sector's role in cutting the NHS waiting list in England by 20%. So the government is using the crisis in the NHS to dramatically increase the privatisation of our public health service. This will mean £16 billion a year of taxpayer money being diverted away from NHS facilities to fuel corporate profits. This is an unnecessary, damaging and ideologically driven move. This money could be better spent building up NHS capacity to provide care for patients. And the private sector will only be able to deliver on this target by poaching staff from the NHS, which only accelerates a vicious cycle of weakening our public health service. Amidst plunging polls and favourability, The Labour government is desperate to convince the British public that they care about the NHS. Yet they continue to make the same mistakes as past governments by refusing to meaningfully invest in the NHS and instead diverting public funds away to the private healthcare sector. With their 10-year NHS plan set to launch in March, alongside a spring budget, it's absolutely vital that the Labour government correct course by rejecting privatisation and generating new funds for our NHS funded through taxing corporations and the rich. At Just Treatment, we will continue to fight for these changes, so share this video, spread the word and join us.
This is how fucked up the NHS is in this country. And this is not me having a go at anybody that works in the NHS. This is me just venting my frustration about the fact that the government in this country has absolutely dicked the NHS to the point where it's dying. It's literally dying. My appointment was at 8:30 this morning. I have stage 4 cancer, so every 3 weeks I come into the hospital and have my treatment. And let me tell you now, when I first started having my treatment in 2018, it was a very, very different situation to the one it is now. I don't even recognise the nurses that I see from week to week. They're always different. There's always different staff. There's bank staff. People are off sick. I just don't see the same people. And my appointment was at 8:30. There was no one before me. The ward opens at 8:30. And it's now 10:15 and I've just been seen. I have a 5-minute injection into my leg, which is what keeps me here, keeps me alive. And it takes 5 minutes. And I've only just had it because when I came in this morning at 8:30, there was 2 nurses on the ward and a full reception. Now, these nurses that are off sick, they are potentially off sick for illnesses and things like that. But also, some of them are probably off sick for the fucking fact that they cannot even be bothered to come into work anymore because they can't bear it. Because the situation is disgusting. The work conditions that they are put under, the pressure they're put under for the lack of pay is not fucking worth it. And I don't blame them for 1 second. I don't complain at all. While I sit there and it's gone an hour over my appointment time, I don't complain because who would I complain to? I'd complain to the very people that are not getting paid enough to be there. I need to take it further. We all need to take it further. We all need to recognise that the nurses and the healthcare assistants and the staff in these hospitals that are basically being underpaid, they need our support. And this is proof of that. 8:30 this morning I was supposed to be in. It's now nearly 2 hours later and I've finally been seen because there isn't enough staff in there. And there's a lot of people to be seen. A lot of people have fucking cancer in this country. And we rely on the NHS. I can't afford my medication. I couldn't afford to pay for this privately. I am so lucky. We are so lucky to have the NHS. And the NHS is being killed off by greedy fucking bastards. And no one cares. No one's listening. No one's supporting. But I support you. I support you nurses that are striking, that are trying to have a voice. Because who wants to work like this? I wouldn't. It's just disgusting. The government, the Tory fucking government, have so much to answer to in terms of what they've done to services like that. Like services like this in the country. It's so sad and it has to change. And I just want to say thank you so much to my nurses, to my doctors, my oncologists that see me at this hospital. You're all amazing and I literally wouldn't be alive without you. Yeah, I just wish that you was treated better.
People say the NHS is great and doctor surgeries are good. They're not. They're really not. Where I live in a little village, you know, we've got a doctor's surgery and it's terrible. Like, I was meant to have an appointment today to talk about changing my contraception because I feel fucking awful, and maybe by some miracle changing it might make me feel a bit better. Yeah, so I had an appointment today to talk to him about. I don't need to talk to him about. I'm 25. I have been here, done this fucking radio twice, 3 times. But they won't let me fucking go onto a clinic list until I've had an appointment to talk about. Literally all I need to I need a coil put in. You know, that's all it. But they've cancelled my appointment today. An hour before I was meant to have it done. You know, and they can't get me in for another week. You know, and I'm like, and I've said to him, like, this is an important appointment, like, to talk about my contraception, because I'm on the depot jab, yeah, and it makes me feel like shit. I've been on it for like 4.5 years. You know, so I've been told I need to change it. I had to wait 2.5 weeks for this one appointment. 2.5 weeks. Yeah, and that's not enough. You know, our NHS at the moment is horrific for young people. For young people, because they don't care. Like, I haven't been going to my surgery. I've been trying to get things like, trying to get a thyroid issue diagnosed, which is a fucking joke in itself. Because apparently I have it, but I don't have it. Because when they send my letters off to my gynecologist, yeah, according to them, I have autoimmune thyroiditis. But according to my doctor, when I see him, I don't have it. So that's just the generalisation of the NHS service at the moment. And I'm having a bit of a meltdown because I just want, I don't know, I just want to feel, I don't know, I want to be off hormones for a bit. I wanted the copper coil put in. I know it's going to take them, my doctor's surgery, 4 or 5 weeks to get the coil put in, because they do a clinic. It's only done in clinic hours, which are clinic hours are once, on a Thursday, twice a month. In a village of 4,000 people. Yeah, let's put it, a village of 4,000 people rely on a doctor's surgery run by, 6 doctors? You know, I've waited 4 or 5 weeks for an appointment, a GP appointment. I live opposite them. My parents live opposite them. I can see them from my bedroom window at my parents' house. I can see my doctor's surgery. But they can't get you in. And when they get you in, like, there's about 2 or 3 doctors there that are absolutely beautiful. Fucking beautiful, you know, will actually listen to you and help you. And then you get other ones, like, I've been told to have a fucking bath and a cup of tea. Maybe that'll make you feel better, you know, because it's always hormones, you know. And that's why I'm trying to go off my hormones. I want the copper coil put in so I can go into a bit of a natural site again, because I don't want to come off contraception. Condoms are not a thing for me and my partner. They never would be. But it's just appalling. Like, they don't even care on the phone. Like, they don't care. You know, and I'm trying to tell them it's an important appointment. Like, I had to take time off work. I had to change all my shifts around, you know, because of it. Because they'd done it to me in the afternoon, which I don't mind, because I mean, I can lay in. You know. But, yeah, to cancel it an hour before, 1 hour before. I was getting ready to go. You know, I was getting ready to walk up, because I live with my partner, so it's just about a 25-minute walk to the surgery, you know. And yeah, now I thought, and they went, it was just sorry. Well, it doesn't change the fact that you can't get me in for another fucking week till next Thursday. Well, it's well over, it's nearly 10 days, 8 days, 9 days. I can't maths right now, but it's just appalling that, you know. I just can't understand why we pay for this. I pay for this through my taxes. I earn enough to pay taxes. My partner pays taxes. But in our village, yeah, the NHS service in this village is appalling. We are forgotten. That's what it feels like. That this, like, little villages. I dread to see what other little villages are like. So let me know if you're in a little village what your doctor's surgery is about. If you've made it this far in the videos, I've kind of just gone on a bit of a rant. But yeah, I'm just having a cigarette in the shed because it's pissing it down with rain. Waiting for my bus that's in 20 minutes, and then, yeah. But I just can't, I just don't know why. Like, at this point, I can't afford to go private. I earn 250 quid a week, if that. I can't afford to go private. I have to wait on the NHS. And I feel like I keep getting forgotten, and it's heartbreaking, and I can't imagine how many other people feel this way, because I can't be the only one. If I'm the only one, fuck. Right, thanks for listening to my rant, guys. I am gonna finish my cigarette and probably cry some more.
This is probably why the NHS system is broken. If you've been following me for a while, you know that I have fibromyalgia and that I have been struggling with chronic migraines. My GP has been awesome and has been trying to help me for the last 6 months, but unfortunately, we have been getting nowhere. So he sent a referral off to Neurology, obviously, which is going to take a while, but we knew that. I got a letter through to confirm this referral a couple of weeks ago, which was fine, and said that if I didn't hear from them till whatever date in June to contact them, because then it means that my letter with the date of my appointment has gone astray, which, you know, is the British Royal Mail system, which is quite possible. That's fine. Cue to today, when I receive a new letter saying, "Oi, you haven't booked your own appointment to Neurology. What are you doing? You need to do this now because it's urgent that you do this." At no point in the letter that I received said that I needed to book my own appointment. That's why I didn't do it. But okay, that's fine. Maybe my mistake, maybe I read it wrong and my partner read it wrong. And there's a website link. Oh, cool, I can do this online. Awesome. So I go online, I log in with my NHS login. It's there, it's awesome. Closest appointment I'm probably going to is in 545 days. So super urgent to book your appointment in it. Yeah. Anyways, the only way to book your appointment is to call this number. It's already been round the mill because I got this letter saying to go online to book my appointment, then I need to make a phone call. It would have been easier for the letter to just say to call this number to make your appointment, but what? That's fine. But then I called the number, which is to the hospital, and it just has this lovely message saying that the lines are very busy, which again is fine, totally expected, and it just disconnects after the message saying that the lines are very busy. And this happens twice. So I finished the day with still no appointment booked. Why didn't they just book the damn appointment with a referral? I've had referrals before, never had to book my own appointment. Why do they provide you with a web link for your referral to book your own appointment and then you just have to make a call? I just don't understand.
Have you ever wondered why the NHS is in the state it's currently in? It can be so confusing because people will say it's the fault of the Tories, or it's the fault of Blair because he set up PFI projects, or it's the fault of Margaret Thatcher because she started on privatisation, or it's the fault of a growing population, or it's the fault of an ageing population, it's the fault of the greedy patients, it's the fault of the lazy GPs. Like, the GPs are not lazy. GPs are working unbelievably hard at the moment. What's happened is when the NHS first set up after the Second World War, the only reason it got set up is because millions and millions of people wanted society to work differently. It's not the only thing that the British government were putting in place in order to improve our society and care for people better. But it's probably the thing that most people are aware of because we all rely on it and it has changed millions of people's lives. But even back then, there were a lot of people telling the government, telling the public that the NHS would not work, couldn't work, shouldn't work. And ever since then, there has been a lobby group of sort of interests, corporate interests, think tanks, politicians, rich folk who haven't wanted there to be a socialised healthcare system in the UK. And from the 80s onwards, those people have had a growing influence on what happens in the NHS. Every government since Thatcher has enabled privatisation within the service, but they've done it very quietly. They've done it through legislation, and they've done it while telling the media that they love the NHS, they support the NHS, they want the NHS to work. It was particularly confusing during the Blair and Brown era because they pumped a huge amount of money into the service while they were also advancing privatisation, and it meant that the service functioned better. The waiting list came down. A lot of people had a better experience in the NHS. But when the Tories pulled the money away in the 2010s because of austerity cuts, as they referred to them, we saw all the cracks. This is why, because of privatisation, because they've fragmented the service into its component parts, it doesn't work very well anymore. People get a patchy delivery of healthcare across the country. People in some places will get a different experience to people in a different place. The funding is very patchy, service provision is not robust, and it's getting worse and worse, right? This government, this Labour government, should have come in and reviewed all of that and worked out how to change things so that the public service was brought back into public hands. We removed the private outsourcing from the service and we increased the investment, because Just to be completely frank, medical advances over the last 7-8 decades have meant that a service of the type that the NHS is meant to provide would be very expensive, but it's also a priority to the public. The new Labour government, if they were going to do anything, would be to talk to the public about what they really wanted from their healthcare system. And if they wanted to continue to offer what the NHS is meant to provide, which is a free, equal, comprehensive healthcare system for everyone, they would have to have a sensible conversation about how much money that was going to cost. That is not what they've done. Instead, Keir Starmer, when he was trying to become leader of the Labour Party, campaigning for it, he told everybody that he was going to remove private outsourcing from the NHS, which would have been a really good thing. And I know loads of people who voted for him specifically because of that. But he quietly dropped that pledge in the summer of 2022, and just last week he's just announced that he's going to be advancing NHS privatisation. We cannot expect this government or any other to be able to rebuild the NHS while they are still advancing privatisation, they are still enabling corporate interests into the NHS, and they are still enabling private shareholders to make money. If we really want the NHS to work, if we prioritise it, and I think we do, because I speak to so many people online, like this is my whole life, right? And it's one of the most important things for people in their lives. They recognise the value of the service when it works. Then we're going to have to fight for it now, because unfortunately, all of the kind of influences that are powerful in our country are combining to just pull us further down this trajectory towards privatisation. We have a mostly privately owned right-wing media owned by billionaires, and they are putting out lots of messaging now about how the NHS model doesn't work and how people are very unhappy with it. Now, people are very unhappy with the NHS, obviously, but it's not because the NHS's model doesn't work, it's because it hasn't been funded and treated correctly. We've got politicians telling us they want to rebuild the service while, funneling out more and more public money into the private sector, which actually doesn't benefit patients. And we've got think tanks, very powerful think tanks in the UK, who are putting out messaging into the media, often writing reports, which kind of make out like the NHS isn't fit for purpose anymore and it needs to be scrapped. People often tell me online that we'll never end up with a US-style healthcare system, that I'm being a scaremonger, but just if you look at the trajectory of where we were 40 years ago, where we are now, the amount of money that's being funneled out of the NHS, the shrinking of the provision of public healthcare in our country, the millions of people suffering, and the massive and rapid expansion of the private healthcare sector, I think you'd be as scared as I am. It's the vulnerable people who will suffer first. It's the people who can't afford to pay for healthcare insurance. It's the people who don't have savings. It's the people with rare conditions who won't be put on one of these elective waiting list drives that Keir Starmer has announced. And we've all got to fight, right? And now fighting puts a lot of people off. I understand that. I didn't used to think of myself as even political. I would have hated to think that I had to go out and fight for anything. But when I got involved in all of this, I was absolutely appalled, guys. And fighting can mean writing a letter to your MP through a Contact Your MP tool. Fighting can mean following somebody like me and sharing what they're saying. Fighting can just mean talking about it. We've got to start talking about this. We've got to start talking about it. And right now, there's an emergency in A&E departments. And the reason that emergency has occurred is because politicians made the wrong decisions. Politicians were advised by healthcare leaders that they needed to invest in A&E departments and emergency services, and if they didn't, there may be a disaster this winter, and they chose not to do so. They chose to make announcements about AI. They chose to develop partnerships with private companies. We're going to have to hold them to account. If you have watched to the end, that's a very long video. I'm sorry it's been so long. Click on my bio, click on the link tree, contact your MP. It takes less than 30 seconds. We're running an emergency meeting about this next Wednesday. Let's fight for it, because if we don't, guys, I dread to think what's going to happen.
I was watching a video this morning on Instagram, Channel 4, and it's about the crisis that the NHS is in. And it was in England, but it's just the same in Scotland. It's the same in the whole of the UK. There was a part where they showed a lady who was in agony and she could not cope, and they had her out in a bed trolley in the hall because they've no beds, they've no spaces. And she was left with a trainee nurse, and the guy knew that he wasn't supposed to be left with her, and he was getting very worried and stressed about her because she could not cope. She could not cope with the pain she was in. And he went and got another member of staff. And he's like, can somebody please get her pain relief because she's in agony and I'm getting so concerned. And the staff nurse was like, where's the nurse? So 20 minutes it took for her to get pain relief, but I think they actually waited longer than that before he asked the second time. And when the nurse came with it, she was like, give me it, give me it, give me it, give me it. And I was hoping that it was IV pain relief so that it works instantly, because when I seen that, I just burst out into tears, because the same thing happened to me 2 months ago in the emergency room, and I wasn't treated really nice. And the people waiting out in the area with me were a lot more helpful than the NHS staff was. But I know that it's not their fault. It's the government's fault. I'm really getting scared for the future when it comes to health for people like myself with chronic illness, with really painful chronic diseases, because after seeing that this morning, it was like a wake-up reality check. And it's making me absolutely terrified for the future when it comes to healthcare. And I just want to say, if anybody at all that works in the government or is in the government and you's come across this video, I'm begging you, like I'm absolutely begging you, please do something. Please do something, because all yous do is just sit in your bums and argue and make false promises to the public and lie. That is all you do. And the biggest crisis we've got right now is the NHS. And that's your fault. That is your fault. You will not pay them any money. It's a national health service. It's for free, right? Where patients don't pay for their healthcare, and as they shouldn't, because I believe healthcare should be free in every country on this planet. But how can you expect, seriously, how can you expect the NHS workers to provide a high standard level care to patients of all levels, the standards that they should be given, when you won't give them any money? They're overworked, they're underpaid, and they're understaffed. People are leaving because, never mind looking after other people, right? They can't even look after themselves because they're so consumed about having to look after other people. And I just don't know why yous are doing this. Like, I really don't understand why yous are doing this. Like, this is the reason why I don't vote for yous, because yous talk mince. Yous don't do anything. Like, yous just make all these false promises, and it's alright for yous. Yous will get money in your pocket. Yous can afford private healthcare. But what about people like us? What about the people that can't afford it? What about people that have multiple health problems? Like, what are we supposed to do?
The NHS is so broken, it might as well come with a disclaimer. Good luck, you're on your own. Patients are waiting for hours, doctors are burning out, and somehow getting basic treatment feels like winning the lottery. At this point, healthcare isn't about getting help, it's about hoping you don't need it. And if things keep going like this, we might as well start Googling how to perform surgery at home. Drop your thoughts in the comments. What's the worst NHS delay you've heard of? And hit subscribe, because staying healthy might be the only way to avoid this mess.